Now the latest in the coronavirus pandemic, and two very infectious Omicron strains have become the dominant COVID-19 variants sweeping the country right now, and more people are reporting getting second infections. Right now, let's bring in Dr. Aileen Marty, an infectious disease expert from Florida International University.
Dr. Marty, thanks for being with us. Experts, some of them are saying that with these strains, second infections could actually happen quickly. Why is that?
Well, the virus is really enjoying being in the human community, and it has adapted even further, and that's what we're seeing with BA.4 and BA.5. BA.5 is the dominant one in the United States right now. BA.4 and BA.5 were first recognized in South Africa, where they caused another huge wave, and they're causing a wave here. It's not as steep a climb with this wave as we saw with Omicron, which was BA.1, but these are much more contagious than BA.1. Their receptor binding domains have a series of new mutations that facilitate getting into our cells, replicating in our cells, and producing more viral particles. So we find that people who had Omicron back in December, January, are very susceptible to BA.5, and they also have some capability of being able to overcome vaccine immunity. So that's not to say that those things are not valuable. They are. They're going to reduce your risk of ending up in the hospital. But we are finding a lot more people with COVID coming for care, and our hospital totals have gone up, and some of our hospitals have quite a lot of patients right now.
All right, so can the vaccines or the boosters still offer protection against this new BA.5 subvariant, or is it, like you say, it'll keep you out of the hospital, but will it keep you from getting the virus in the first place?
It probably won't keep you from getting the virus in the first place, even if you just had the vaccine recently and are high up in your immunity. That's going to help, and the more neutralizing antibodies you have, even though it's against the original strain, is going to make it harder for that virus to replicate in your body and lead to severe disease. So it's still good to have a vaccine. Yes, a little bit of having had COVID before, having a different SARS-CoV-2 variant has a little bit of protection, but it's not going to keep you from getting sick. It's just a matter of how sick.
Well, let's talk about those people who've gotten COVID multiple times. There's research out there that having it a second or third time increases your risk, though, for lingering symptoms or long COVID. Why would that be?
Well, think of it as you have a wound and it heals, and you get cut in that same area again and again and again. And every time you do, that tissue becomes weaker. So in many ways, this is analogous to that. You're just adding more damage to little parts of your body. And particularly every single time that you get this infection, you have that possibility of forming what we call autoantibodies, sort of the type of antibodies that people have with autoimmune disease that can lead to long-term inflammation of blood vessels in many different parts of the body, including the brain. And all of this has negative long-term consequences. So we've seen that people who have repeat episodes of COVID-19 have a higher risk of ending up with Parkinson's and Alzheimer's. So this is something you really want to avoid. You don't want that second, third, fourth, fifth infection. You really want to keep yourself safe.
Okay, Dr. Marty, thank you very much for joining us live tonight.
My pleasure, always a pleasure.
Okay, thank you, Doctor. And